O- Okay, so welcome everybody. As promised last time, this session of review of Dr. Gabor Mate's book on When the Body Says No is diving a little bit more into details of different cancers. So even though we talked about a personality type C, which is more common personality traits among people who develop cancer, if you look at different subgroups of cancers, there are a little bit of difference in personal traits. So for breast cancer, Dr. Levy from National Cancer Institute in Bethesda looked at women with breast cancer and studied their natural killer cells and noticed that in breast cancer patients who were not able to express anger or adopt a fighting stance, or if they didn't have social support, the natural killer cells were suppressed. And women who could have a more assertive attitude and women who had more social support, they had less likelihood of breast cancer spreading in their body. So suppression of anger and a passive stoic response style seems to be associated with biological risk for breast cancer. Another study from 1974 is a British study. They looked at 160 women and noticed that the common personality trait amongst them was extreme suppression of anger. And this was often masked by a facade of pleasantness. So you look at them, you don't feel they're angry because they probably are not feeling angry. They continue to suppress all of their anger. And they manifested this through denial and unrealistic self-sacrificing behavior. It was also seen that they had a feeling of helplessness, hopelessness. They were very hyper-conscious people. They had a tendency to become a doormat, very harsh self-judgment on themselves, and a chronic inability to be true to themselves at the deepest level. And psychologists in another study interviewed patients who were admitted to hospital for a breast biopsy, but without knowing the result, just by looking at the psychological factors alone, with 94% accuracy, could predict which one of these patients' breast biopsy was going to be positive. In another study, a German study, they studied 40 breast cancer patients and matched them with 40 healthy women. And again, psychologists were able to, with 95% certainty, identify the breast cancer patient, not by knowing, but just by personality traits. Now, moving to ovarian cancer, you see that the personality traits are slightly different. Women with ovarian cancer are perfectionists. They have a tendency, when you talk to them, they have a tendency to go into a labyrinth of details on every topic. And that is how they keep their anxiety at bay. They seem very uncomfortable, even with brief silences during a conversation. They adopt a mothering role in any relationship, including in their relationships with their husbands or partners. They are very dutiful towards their parents or sibling or whatever. They have to take care of everybody. A study at University of Pittsburgh in 2001, because there is a link between infertility and ovarian cancer. So they looked at a group of patients that absolutely have no identifiable physical or physiological reason not to ovulate. But they are categorized in what is called functional hypothalamic amenorrhea, meaning that it's just something coming from hypothalamus. Nothing wrong, nothing else is wrong. Everything's functioning okay. And in these women, they reported that they had more dysfunctional attitudes, particularly a significant need for approval by others. They're very vulnerable to depression. They are very concerned about judgments of others. They also noticed that subtly, but not significantly, they had disturbed eating habits. So they were more concerned about dieting. They were concerned about their weight. They were fearful of weight gain. And they also had tendency for binge eating. So emotional eating, basically, and having problem with body image. An endocrinologist in Canada published a study in Canadian Journal of Diagnosis and showed that 1/3 of regular asymptomatic periods in women, in healthy women, they have disturbed ovulation. So even though periods are coming normally every so many weeks, and they don't have any sign or symptoms that their ovaries are dysfunctioning, but they're not really ovulating normally. And they attribute that to an imbalance or incoordination in the signals sent from the hypothalamus and pituitary gland to the ovaries. And these are often caused by adaptations related to life cycle, changes in weight, psychological stress, excessive exercise, or illness. So we all know that women who are, for example, anorexic, they lose their periods. That's a fact. On the other extreme, women who are athletes, like Olympic athletes, or like very, very much work with their muscles, they lose their cycles because of the hormonal imbalance. And every time that there is inovulation, infertility, the risk of ovarian cancer rises. In patients with cervical cancer, looking at healthy women who just had one abnormal pap smear. We're not talking about some people who had locally advanced cervical cancer. Again, in this group, researchers were able to predict with about 75% accuracy individuals who had early cervical cancer simply by having them fill a questionnaire, which basically talked about their emotional states. And they found that these women, again, had helplessness, some sense of frustration, which could not be resolved in the preceding 6 months, which goes to the topic of tomorrow's map, as we would investigate what potential event in lives of people who have developed cancer within a year prior to the diagnosis has led to cancer. Interestingly, leukemias and lymphomas, and I didn't know that, they're also hormone dependent. And they are mainly affected by cortisol, which is secreted by the cortex of adrenal glands. At University of Rochester, there was a 15-year study that looked at people with leukemia and lymphoma, and they found that they had a higher incidence of emotional loss, separation, that in turn brought up feelings of anxiety, sadness, anger, or hopelessness. So this was commonly seen among patients who later developed leukemia and lymphoma. Prostate cancer patients are interesting in these personality traits that they have a tendency that they want to help everybody. They want to help everybody at any cost. They would not say no to anybody because they feel guilty if they say no. So they're always saying yes to everybody, helping everybody at the cost of their own health and well-being. They let other people take control of their life. They really let go of control of their life. Professor James Dabbs, a social psychologist at Georgia State University, looked at African Americans. It is a known fact that African American men have a higher likelihood of getting prostate cancer. They also have a higher likelihood of dying from prostate cancer when they get it. So he looked at African American in the United States and then looked at Nigerian men. And interestingly, he saw that African American men had 6 times higher risk of developing prostate cancer compared to Nigerian men. So it had nothing to do with the race. It was really the social anxiety and the stress. Emotional isolation in men who were divorced or widowed, or generally had some kind of personality that they're emotionally dependent on their spouse, even when they were married. If they were emotionally dependent and they were not getting their needs were not met. So even in a marriage, if they felt emotionally isolated, they had higher risk of developing a prostate cancer. Testicular cancer is interesting, a little bit different, obviously a hormonal disease. In a British study, they looked at the personality traits of people who get testicular cancer, and they have a significant reluctance to get help. So that's different from prostate cancer, who wants help other, but these people are reluctant to get any help for themselves. And in fact, their diagnosis is on average about 4 months delayed, maximum of 3 years of delay, not because the doctor didn't make the right diagnosis, because they didn't seek medical advice. They just didn't go. They had symptoms, but they just didn't seek help. So that's one of their characteristics. The other thing that was very interesting in this group of patients was that their level of closeness and identification with their mothers was a significant factor in developing testicular cancer. In colorectal cancer, obviously, like any other cancer, as we discussed in previous sessions, chronic stress and chronic stress response in our body is the factor. But what is important about gut is that our guts are not just an organ of digestion. They're actually a sensory apparatus, and they have their own nervous system. So as we discussed before, using the term gut wrenching is not like an incidental term. That really means an event has such a negative, a stressful impact on your physiology and your body that your entire gut feel it. And the way it feels that is that a lot of stress hormone would be secreted, things that are called neuropeptides that in turn cause secretion of histamine and prostaglandin. So the entire gut is always in a high state of inflammation. And that is usually what leads to colorectal cancer. Lung cancer is was very, very interesting for me. And I want to repeat a couple of the sentences from Dr. Mate's book 2 or 3 times, because I know that a lot of lung cancer patients, because they have smoked, they feel a lot of guilt that, only if I didn't smoke, I wouldn't get cancer. It's my fault. We actually have a member in our cancer study group who said that in one of the meetings, said it was my own fault. So it would be interesting if she listens to this session. So patients with lung cancer have a tendency to bottle up. So they just swallow all of their emotions, they don't express. Very, very interesting observation was made that patients, smokers, sometimes some of them inhale the smoke deeply, and some of them don't. They just smoke it into their mouth and get it out of their mouth. They don't inhale it. You would think that if somebody inhaled the smoke deeply, they should damage their lung more badly, right? The study showed it was the opposite. In men who developed lung cancer, the ones who lacked the one who didn't inhale actually had a higher risk of lung cancer, because, as we all know, breathing has a correlation with our emotions. When we are in survival mode, emotions of fear, anxiety, all those things, we have a shallow breathing. And the very first thing that it starts with every meditation, every yoga, every time you want to calm yourself, everybody asks you to take a deep breath. So these men, the reason they didn't inhale is not that they didn't like to inhale. They just usually have shallow breathing because they're always in survival mode. That was very interesting to me. A study, this is the study that is really fantastic. A prospective study, German study, German, Dutch, and Serbian. It was done in a 10-year period in former Yugoslavia. And they looked at the relationship of psychological risk factors to mortality in patients with lung cancer. They had 1,000 men, 400 women. They were all interviewed between 1965 and 66. The questionnaire that they filled had 109 item questions about adverse life events, sense of long-lasting hopelessness, and hyper-rational, non-emotional coping styles. By 1976, which is 10 years later, over 600 of study participants had died of either cancer, heart disease, stroke, or other causes. In the group who died of cancer, the single greatest risk factor for death was 11 questions that were related to what is called rationality and anti-emotionality. So they call it that RA. So from 109 questions, 11 of them were questions related to rationality and anti-emotionality. These people, majority of these people who died of cancer, they had answered 10 of these 11 questions positively. And when they compared to the remaining subjects that they had answered only 3 of 11 of these questions positively, they had a significantly higher risk of developing cancer and dying of cancer. So smokers who had no incidence of lung cancer, unless, this is the important sentence, smokers had no incidence of lung cancer unless they also had RA scores of 10 or 11, suggesting that any effect of smoking on the lung is essentially limited to a susceptible minority. This minority who answered these 10 out of these 11 questions about rationality and anti-emotionality positively. And this basically is not saying that smoking doesn't play a role in lung cancer, because all the 38 patients in this study who died of lung cancer all were smokers. But what it's saying is that for lung cancer to occur, tobacco alone is not enough. Emotional repression must somehow potentiate the effects of smoke damage to the body. So it's a combination of emotional suppression, which they detected by these 11 questions. The combination of emotional suppression, bottling up all the emotions, and smoking causes cancer, not smoking alone. That is why not every smoker gets lung cancer. So with that, I'm gonna stop it here and open for any question after I stop the recording. Before I stop the recording, I want to say that next week would be the last session for review of Dr. Matei's book, and we'll talk about what he calls the 7 A's of healing, which would be a very, very interesting and helpful session. Thanks for participating.